Good morning. My name is Peter Chernak. I'm the Executive Vice President at the Home Care Association of New York State. And I'm so thrilled to welcome you all to this third in a series of 5 webinars. This particular webinar's topic is best practices in prevention and control that address emerging infectious diseases, novel influenza, and infections in the home and community-based service population. And we're going to have a really strong presentation from Melanie Ronda, who has been with us in the planning and has also delivered one of our first 2 webinars. So we're real excited about that. But I'd like to welcome you all and add my welcome to my welcome greetings from our President and Chief Executive Officer, Al Cardillo, who has joined us and smiling in the Zoom square there. So good morning from Al. This project is, as I said, part of a series of webinars, and the focus of today's webinar is on best practice strategies and interventions. So I want to again thank you all for attending. And I also want to recognize that we are supported in this webinar series and in other ways as well. But in this instance, from a grant through the U.S. Department of Health and Human Services, Administration for Strategic Preparedness and Response. And that's administered through the New York City Department of Health and Mental Hygiene Office of Emergency Preparedness and Response. And on that note, a real special thanks to Fidel Monroe, who's the senior program manager for long-term care at the Bureau of Healthcare and Community Readiness Office of Emergency Preparedness and Response at New York City Department of Health and Mental Hygiene. Fidel is a tremendous supporter and promoter and an excellent resource in all of our efforts in emergency preparedness and in this particular project as well. And we're pleased to partner here with IPRO for this webinar series. And for today's webinar, the IPRO team has made it just an excellent contribution all along. And my gratitude to Sarah Butterfield and the team at IPRO, Dr. Terry Lebowski, and of course today, Melanie Ronda. So I am absolutely pleased to introduce to you, Melanie, and recognize that you may have seen her before, but if you haven't, you're going to enjoy her presentation. She's really quite terrific in this role. Melanie is a senior healthcare quality and infection prevention leader with more than 2 decades of experience across acute and long-term care settings. She currently serves as the Senior Director of Healthcare Quality Improvement and Infection Preventionist at IPRO, where she leads large-scale quality improvement initiatives supporting hundreds of nursing homes across multiple states, is recognized for her expertise in infection prevention, regulatory readiness, and process improvement, with a proven track record of improving New York State's survey outcomes. A frequent state and national speaker, she has also co-authored mandatory infection control education that meets New York State requirements and is deeply committed to advancing patient safety and quality outcomes. And we're thrilled to have her with us this morning. So, with no further ado, Melanie Ronda.
Thank you, Peter. Welcome, everyone. I want to use chat today, so please go ahead, open up your chat, introduce yourselves. It's really helpful to know who's here and what population you're serving. Go ahead and put that in chat. So today's learning objectives, we want to describe core infection prevention principles, which is really important and really challenging in your environment, right? So identifying New York State home care infection prevention and control program requirements, applying infection control precautions in home and community-based settings, define staff, leadership, and patient roles, recognize components of an effective IPC program. So we have started this program by talking about emerging pathogens and challenges that we may face being healthcare providers in New York State. And I do want to just bring forward, hopefully many of you have joined the sessions. Maybe some of you came to the in-person session as well, but this is a quick review talking about respiratory infections, the transmission, the symptoms, and time from exposure to infection. This is really important when you start considering why are we always talking and so concerned about infection prevention and control? And it's because of the spread of bacteria or virus. It is the spread and the concerns that we can get from coming in contact with something to our persons or to the people that we're serving. So, this is a nice quick review on respiratory, COVID-19, RSV, and influenza. So, let's talk about why infection prevention matters in home care. You are caring for some of the most vulnerable patients in home care, right? So you have high risk individuals, older adults with chronic illnesses or devices. They wouldn't need home care if they were completely able to take care of themselves. They're susceptible to severe infections. What is a mild cold for you or myself or a healthy person can be life-threatening to the elderly or immunocompromised home care patients. Infections for our home care staff, our patients may equal hospitalization. That's a real challenge. We do not want our patients from home having to go to the hospital. Infections acquired in home care lead to emergency visits and hospital admissions. A large study found that 3.5% of home health patients develop an infection that led to an ER treatment or hospitalization, and about 17% of unplanned hospitalizations of home care patients are caused by an infection. 17%. And think about how many people you're serving. How many of them are you serving? 100? Are you serving 200? Are you serving 300? And what's the likelihood that they may end up in the hospital with an infection? Preventing infections helps patients stay home safely. It helps keep your staff healthy. Home environments are a challenge. We know that. We've recognized that when we were in person a couple weeks ago. We really talked about some of the unique challenges that you all have. Like in controlled, it's not like a controlled facility environment. When we're talking to hospitals and we're talking to nursing homes, there's specific controls that are within that environment, like dust, reducing of dust and clutter and um, just having the proper equipment and hand hygiene stations. That's not like at home. There's clutter and poor sanitation, lack of running water in some of the places that you walk into, unclean conditions. There might be animals, pets, pests. What about cockroaches or carpet beetles or things like that that you can come in contact? Another area that infection prevention matters is controlling effective infection control for home care also safeguards home care workers. You don't want your staff being sick because how many of your patients will that impact, right? You could really lose out on seeing a lot of your patients if you have two or three staff members that are sick for a week. Why focus so much on infection control in home care? Our patients are often vulnerable, and like I said, you have to be cognizant of the devices and their environment. I'm going to move on and talk a little bit about the core infection prevention principles. Hopefully, most of you have heard of the chain of infection, and I have a slide specifically around the chain of infection. And then standard precautions. Every patient we need to use standard precautions. We used to talk about universal precautions. Universal precautions have been embedded into standard precautions. Standard precautions allows the leeway to determine when you might need to up your game, right? So to this person's actively coughing, but last time I came into the home, they weren't coughing, but because they're coughing, today I'm going to put a mask on. I need to irrigate a wound today, and I've noticed there's a tunnel, and I'm going to use some pressurized spray. And because of that, I think I might need goggles or a face shield and a gown to prevent that spray back on me. So standard precautions allows for us to increase what we need to do. Transmission-based precautions are what we do when we know there's a problem. We already know this person has um, a resistant organism, active diarrhea, or some reason why we need to step up our game when to prevent the spread of illness. And infection prevention's everyone's responsibility. So we don't want to just consider that infection prevention is only the staff. We need to be talking to our patients and we need to be talking to the families. When we are guests in their home, we need to be telling them the things that they need to be concerned about and being having them active participants in the patient's care when it comes to infection prevention. Chain of infection. I thought this was a nice guide because it talks about the chain infection. You need the infectious agent, so the microorganism, bacteria, virus, fungus. You need a reservoir, so the reservoir is the source. Habitat for the organism to grow, could be human, could be animal, food, air, soil, water, equipment. Think about that. When you walk into a home, what could be in your reservoirs? Go ahead and put that in chat. Think about all the different things that you might come in contact with when you walk into a resident's home that could be a source for infections. A port of entry, sorry, a port of exit. So excretions, um, ex excretions, secretions, mode of transport, droplets, contact, airborne, vector, fomite. So we talked about droplets, that's the cough, the sneeze, the contact to the organism that we then have on our hands, that we move to the next person that we're going to go visit, or we move to our families. So being aware of that mode of transport. Port of entry. So where could we pick up something? So we are coughing, we are sneezing. When we talk about respiratory, we're coughing, we're sneezing. Then we inhale it. So we have mucous membranes that are allow for that entry of the virus, the bacteria. And now are we susceptible to get that organism and become sick? And as we already talked about, the very young, the elderly, those with chronic diseases, malnourishment, and immunocompromised are the most susceptible. So not only do we need to consider we know what's right. We know we want to protect our patients. We want to protect our staff, but there's actually reasons and requirements around that. Infection control programs, new state regulation requires home care agencies to have a comprehensive infection prevention and control program. I learned that a lot of you have some great programs. You're really trying to get down to solving problems. It was, again, the in-person program was fantastic. The program must be written policies and procedures for preventing and controlling infections and in all services provided. So, for examples, agency must have policies on cleaning and disinfecting medical equipment used in patients' homes. So, how are you cleaning and disinfecting? And if those products are coming back with your staff, how are you ensuring that it was cleaned before it goes into another residents or patients' home? So being cognizant of that. The agency's governing body, governing authority is responsible for ensuring that these policies are in place, current, and consistent with professional standards. They must be reviewed regularly, at least annually, and updated as needed. Leadership must also designate qualified personnel to lead the IPC program. And that's important too. Making sure you have the right person, that infection prevention and control does matter to them, that they are comfortable having hard conversations. They're comfortable having a conversation with a family or a patient or staff, making sure you have the right person to do the job. So these requirements apply across home care. settings, licensed home care service agencies, certified home health agencies, and hospice programs. For instance, hospice regulations specifically mandate an agency-wide infection control program covering surveillance, prevention, and investigation of infectious diseases. I learned many of you are really monitoring who has an infection and how did that come about, and that's fantastic. And don't forget that you have some requirements around OSHA's bloodborne pathogen compliance. So, how are you managing that? You have staff going into the home. Is it a safe needle that they're using? Do they know how to manage and dispose of needles? Is there a place? Are you teaching your families and patient what to do when if they're using the hard laundry detergent to put the needles in? How are they sealing it? Do they know where to go with that information? And then also making sure you have an implementation plan related to a bloodborne pathogen exposure. So that's really important. So if one of your staff somehow gets in contact and gets a bloodborne pathogen exposure, what's your next step? Who's going to see them? How are you going to discuss the risks of exposure to HIV, hepatitis, and other bloodborne pathogens? So now we've talked about the regulatory compliance. Now we're going to talk about staff health requirements. So it is our role as healthcare providers to make sure that our staff are safe and healthy, and they have the things that they need to make sure they remain safe and healthy, and that they're not spreading germs to our clients and patients. So pre-employment health screenings, hopefully that is happening in your facilities, or I don't know how you all are doing that. If you have one person in your location, how do you do your pre-employment screening? Do you ask your staff to go to their provider, or is there a provider that you want them to go see? How are you doing pre-employment screening? So there should be a health assessment. They should be free from impairments that could risk patients. So active infection. Staff can't begin seeing patients until they are cleared. You should know their immunization status in New York. So New York requires proof of immunity to rubella for all personnel and measles immunity for personnel born on or after January 1st, 1957. Acceptable proof includes vaccination or titers. So many of you might be doing titers. And then I do want to just point out the annual TB screening. There is some up information. There's a link to the DAL letter that from 12, so from December 2020. I don't know if you all have updated your information based on this, but I just wanted to put that link in. You can review it, determine against your policy if you're doing the proper TB screening at this point. And then annual flu vaccine or masking. So I'm going to ask you, can you please put into chat, is it mandatory for your staff to get to be offered the flu vaccine? Yes. So that's kind of, I wanted to see, it says yes, but we do have the ability to decline, but they must wear the mask. So, have you seen a decline in flu vaccine uptake since um, COVID? Are your staff less likely or haven't? Do you know? 20%. Across the country, I work with facilities across the country. We have seen a decline in flu vaccination, but we are seeing an increase acceptance for patients for RSV vaccine. So that's been interesting to me. But staff have been what I'm hearing mostly is like it's vaccine fatigue. It's very challenging to get people to really get the vaccine. I would recommend if you have not looked at the Families Fighting Flu Org, familiesfightingflu.org. A lot of great resources to encourage your staff to get vaccinated because it kind of hits home to the realities of how flu can impact your staff personally. You know, vaccine is a personal thing, and understanding how influenza can impact your life personally is really important. So thank you for adding into chat that you are offering. A lot of people are refusing. That is helpful to know. If you all have found a great way to get your staff to want to be vaccinated, please share. That's so important for us to share our knowledge. Put it into chat. What has worked in your facility to get in your agency to get the staff to want to be vaccinated? So let's talk about infection training and policy. So infection control training at orientation, I'm guessing all of you are doing that in some capacity. You want to make sure that you're doing it to make sense, especially when you have new staff that's new coming into home. So why do these things really matter? Simplify the reasons, right? So there's glow germ. How many of you use glow germ to help train, or the caught red-handed to help train people on how germs move around the room, move around on your hands, move around on your wrists, right? So you can put your gloves on and you can see where it's hitting at your wrists. You can wash your hands. You can notice that if you have dry, cracked hands, there's there is the glow germ gets left in the crevices. These are good things for your staff to know that they need to be cleaning their hands, keeping their hands healthy, be getting around the fingernails. This is how organisms spread. So making sure you're doing things that not only just repeating, wash your hands. Wear your gown, but giving people the reasons why it's so important and what the risk is so helpful to your staff. And then annual refresher education. So I don't know how often you go out and you audit the frontline staff, but making sure that you are auditing, identifying the opportunities. We did a survey a while ago for Project First Line. We learned one of the areas the staff generally had some questions about is around C. diff and wearing PPE and cleaning their hands and when they need to do what. So even though I think a lot of us believe we've done the training, it's made sense. Getting out there and really understanding from your staff, does it truly make sense? Did I meet the mark when I was out there training? That's really important. Making sure it met the mark. So PPE, so personal protective equipment, needs to be provided by the agency. And how are they getting that? And is it easy? Can one of your staff members say, well, I have somebody with a draining wound, so I've been wearing a gown more frequently than you may have expected, and I need more gowns. Is it easy for them to get them? I learned that some of you, and I'd be curious to know how many of you have an opportunity where your staff can go on and click and then order and it gets delivered to their house. I thought that was fantastic. Is that how your staff get their supplies, or is there a different way? Please share in chat how that's happening. How are your staff getting their supplies? But making sure folks actually do have access to the appropriate PPE, the glove sizes that they need, because that's a big deal. So if you are getting large gloves and you have small hands, you're not protected. I mean, they just slide off. So making sure the right size and the right type of glove is really important as well. And then ongoing compliance monitoring. So like I said, how often are you going out and taking a look at the actions of your staff and making sure that they have what they need? Just asking them questions. What challenges are you coming across? Because again, in a facility, if you're working in long-term care, if you're working in a hospital, you kind of know what challenges a person's walking into. With your group of people, it's so unique, the challenges they're walking into. So thank you for for adding in chat how many of your staff are getting the order and delivered to the house is fantastic. You also have supplies in the office and they're sent to the home. So having those supplies on hand to get them to your staff quickly. And remember, this program that we're providing to you is based on a pandemic or another episode of something, right? So if it's avian influenza, if it's another COVID pandemic, it's about speed. We need to be able to provide the equipment as quickly as possible. And I think we learned a lot about that in the past, you know, past 5 years. So roles and responsibilities. So this is where I'm talking, about who's getting the information out to the staff, who's doing the education. Is it important? So leadership sets the culture. We know this. If your leadership's like, well, it's too expensive. We aren't going to be able to provide that. That's not really necessary. We don't have the resources for that. That's gonna change the culture. In your organization because now you're stepping the IP might have all good intentions, or whoever is responsible for your infection prevention and control program might have all good intentions. But if in fact they reach out to the owner of the company or the manager of the company and they say, well, there's no funds for that. Well, now it's a real challenge making sure you have what you need. So you must create an environment where infection control is taken seriously. This means establishing a non-punitive culture where, for instance, any staff can speak up if they notice a breach. So that's another thing. I walked into Mrs. Smith's home and I'm taking over for someone else, and I noticed there's dirty attends that wasn't bagged up and thrown away, or there's no running water, there's no this, there's no that. But just being aware that that person and comfortable that the new shift person would be able to call someone and express their concern without retribution. So leadership also ensure we have qualified infection control professionals guiding the program. So that's another commitment from leadership. Do you have someone that you feel is competent, excited, ready, and willing, and wants to make change and wants to do the right thing, wants to get the message to the staff that makes sense? So again, like I said, not all messaging. I might be able to talk one way to IPs in a hospital, and I might talk very differently to the CNAs in long-term care, right? So we have to make sure our messages make sense to the people that we're talking to. So taking the time to acknowledge who we're speaking with and explaining it in a way that makes sense to them. And then making sure it's comfortable if that somebody asks for their supplies. And I love all of the different ideas you're putting in and how you're creating a safe place to ask for supplies so people don't feel like they have to work short. And then your infection control coordinators, is that their role? Do they have multiple roles? Is it the educator in the IP? Can you put that in chat? Who is your infection control? Who's monitoring infection control program? Do you have somebody designated or is it a multi-role position? And I suspect it's a multi-role position for most of the groups. But making sure they do have some basic knowledge, right? So there is for long-term care, there is an infection control CDC train for long-term care. It's a basic knowledge for infection prevention and control. And that's it. There would be some differences, but that's a place to start if you don't have a training program and you have somebody is responsible for infection control. At least it's a place to start. I would also recommend that you get very comfortable with APIC, so the Association for Professionals in Infection Control, and use the Department of Health too. New York State and New York City Department of Health can help with some materials at your fingertips. And frontline staff. So field staff must follow precautions consistently. We've already talked about that, making sure there's some way of auditing once in a while or at some frequency, and then do training. How often are you bringing your staff in for in-person training? Is that and that might not be possible, but I'm curious if some of you have the capacity to bring a group of staff in for in-person training? Are most of it going through a learning management system and they're learning whenever they have the time? So thank you. So we make field visits about 5 a month, rotating clinicians. Nice. And frontline staff, that's that. Who is your frontline staff? So you have nurses and probably occupational therapists and PT and home health aides and a variety of different people that are coming into the home. So making sure that they're all, again, very comfortable with the protocols you have in place and know how to follow them. And then you can't talk about roles and responsibilities in infection prevention and control without talking about patients and families. And they have roles and responsibilities as well, right? So making sure they're educated to understand the challenges and the risks, benefits around different things. If family members are coming to visit mom because it's Thanksgiving or a holiday and they are going to be coming into town, if a whole group of people are coming in and there's little children that have runny noses, how can you protect that immunocompromised patient in home and being comfortable to have provide some training and education around that? And also vaccine, right? So you're to enhance and extend the safety net around your patients, you want their families to be vaccinated and less likely to bring in the flu or bring in COVID or RSV. That it's really important. And so often the families aren't thinking that way. They just, you know, children often have runny noses. It's not that big of a deal, but that runny nose to a 96-year-old status post-stroke with diabetes and COPD could be a really bad situation. So I see I got some things. Managers go out with their nurses and HHAs, therapists, and manager goes out for field evals every year. We do a yearly competency like that for hand hygiene and bag technique for a clinician. Fantastic. Field visits, lots of field visits. Fantastic. So, risk assessments in the home. This is where I think you all have a very challenging situation because you don't know what you're walking into. Tell me in chat, who is the first person that visits the home? Is it always a nurse that goes in first to do an assessment? Nurse or PT, RN, nurse. Yeah, nurse supervisor. So you're walking in, you do not have any idea what you're walking into, right? So it's not like you can say, well, how clean is your house? How cluttered is your house? Do you have walkways? How many pets do you have? Is somebody been able to empty the litter box in the last week or so? So you are walking into the most difficult situation because you don't know what you're walking into. So every home is unique, and part of the job of your RN and PT or nurse supervisor is to actually assess the situation. Prepare the next staff that's going to be going in with what their needs are. To learn, does that patient have an MDRO history in an open area? Does that patient have a risk for tuberculosis, pulmonary TB? Do you need an N95? Is it a directed DOT? Directed observed therapy for TB that your staff's going in. I think that might be just county that does that. Maybe some of your people do. But just really doing a nice visual scan. What's the fall risk? What's the risk in this home and being prepared to assess the home environment, observe the patient and caregivers practices. That's another, are people cleaning their hands when they're helping mom? Do people know what to do to prepare food? When you're providing training for the wound care, is it easy for the person to understand why they need to do what they do? Again, You have a super hard job. If you want to put a scenario in to chat that you came across that was unique, because it's always helpful to hear the unique and how you problem solve that. And I know in my area, because I'm more rural, there would be homes that would not have running water. That would absolutely be the case. There would be home that would not have running water. And I know that hoarding is a real challenge as well. There's a lot of hoarding situations. So cleanliness and animals and rodents are another difficult situation. So I'd love to hear any experiences that would be helpful to talk about or how you've managed them. And so adjust precautions as needed. So that being said, does your nurse, does your PT know, okay, this home has some opportunities to be cleaner. So we are going to up our precautions in this home because we know we're going to set this up. This person, we have a staff member that's going in first thing in the morning, and then they have four more people to go see. So we want to make sure supplies aren't going into the home because there's bed bugs. There's some carpet beetles. We want to make sure we've set this up to be the right, is it the right time of day? And is the person that's going to be going in knowledgeable and can manage the situation you're going into. And I do understand once you identify bed bugs, you probably pull your teams out and you require them to treat, but you may not know, right? It may have already, you may only find out as a result of your staff having bites or whatnot. So I don't have any, oh, I was hoping to get some scenarios in chat. Um, so let's talk about standard precautions. Like I said, standard precautions are for all your patients. Hand hygiene. What's the challenge with hand hygiene in your homes? Is the sink clear? Can you wash your hands? Do you have the right soap? Do you have a way of drying your hands? What I heard and what I've learned from all of you is that most of you are sending supplies with your staff so that they can wash their hands properly and also hand sanitizer, right? So the hand sanitizer is definitely something has been fantastic to have hand sanitizer as an option, especially in a place where you don't have running water. Gloves for body fluid contact. It's really important that your staff realize that gloves are not 100%. They are not a constant barrier. They actually are allowed to have holes in them. So if you did some research on it, you'd see there is some ability. FDA does allow some microscopic holes and they can still be mass manufactured and sent out. I think it's like a 95 to 98% success rate. So there's still that percent. So that would think if you look at a box of gloves, there might be one or two that are going to fail in there. So gloves are not the end all be all. PPE as indicated, which we already talked about. So again, I highly recommend that you go out and you just ask your staff, do you think you have the right amount of supplies? Do you feel comfortable with using PPE? Are you comfortable with asking for more supplies when you need it? And then safe sharps handling. Do people know what to do with their sharps? Do do you train folks on how to manage sharps? And you just so everyone knows, all hospitals and nursing homes in New York do take sharps. So that
Right.
if you need to, oh, were you going to say something, Peter?
I was just going to add, Mel, that since your next bullet is environmental cleanliness, there were a couple of scenarios or illustration exemplars in the chat about home environment. You may want to go back to. Didn't know if you saw.
Oh, good, thank you. Had a family with hoarding behavior, rodents all over, was difficult to convince cleaning the place. After several months, family agreed. That is such a challenge because people don't live with hoarding and rodents because they think it's a good idea, right? So you're dealing with a very emotional mental health situation. I know that it, and they're living in it, right? So that is such a hard situation. Do any of you, well, I did hear in one of the last calls, one way some of the home care have had to pull their teams out until it was a more safe environment for their teams and then get resources involved. Um, and we got a community resource to help pay for the exterminator for bed bugs and roaches. Oh, that's fantastic. Yes. Yes. And oh, you call adult protectives. Yeah. So that's it. Again, it's a really hard thing. I know of a scenario where um, someone always they needed some assistance. They didn't really want to let anyone into the house. They wouldn't let anyone come in through the front door. They allowed someone to come in the back door. When they got there, the the house was filled with dogs in cages and feces, and it even was as bad as in the basement there were dogs that had passed. But the sad part is the people were living in this environment, right? So the charge is challenging because there was the dogs and whatnot, but it's a very challenging thing because they didn't realize it was that bad. They were living in there, and I know you all get and have these type of situations. So hard to manage, and then even working with it through it with your staff, because it's not as simple as just go throw those things away. Just clean up and throw those things away. Just find new homes for your dogs. You're not able to care for them anymore. It's not that simple. So thank you for sharing. Hand hygiene. So soap and water when visibly soiled or C. diff, right? Or diarrhea. So it's not just C. diff, it's actually diarrheal illness. We should be soap or water washing our hands. Visibly soiled before we're eating, um, all of that. And I guess I would say, do you believe confidently that your staff knows when it's ideal to soap and water wash versus alcohol hand sanitizer is fine. So alcohol-based hand sanitizer is for routine use. And the beauty of alcohol-based hand rub is it actually is it's killing the germs on the hands. So it's not so much technique based as soap and water is. Soap and water base is it there's technique to it in order to have clean hands in the end. So all you have to do is squirt for alcohol-based hand rub, squirt it on and rub till dry. With soap and water washing, you actually do need to scrub. You need to get into all the crevices. You need to rinse the germs down the drain and then dry your hands and shut off the faucet. So any way that you do that differently, you could still transmit organisms. And clean your hands before and after every visit. And always clean hands after removing gloves. I can't say that enough. That is so important. This is just a resource I thought was nice. You could use it, you could provide it to your families. Just, it's an interesting, I think healthcare providers might need to clean their hands as many times as 100 times per 12-hour shift. That's a lot, right? So, um, that's interesting. And then this is a nice resource that we have on cleaning your hands and two methods for hand hygiene. You can provide this to your staff. You could also provide it to your families and residents and patients. So it was something we developed with Project First Line. Another area I wanted to talk about is the bag protocol and the nursing bag infection prevention and control techniques for in-home healthcare providers. So we worked with New York State epidemiology side to create this document for you and your for your staff. And it is we believe it's helpful. And in case you don't already have a training tool, this might be helpful for you and your staff, and I can get the links and or the attachments, and I'll give them to Peter to get them sent out. So yes, we can get you the attachments for these resources. Does everyone have a bag protocol already? Yes, great. That's good. And we talked a lot about what about when you have staff that don't drive. So they're using taxis or Ubers and they're getting, or the subway, and how are they managing their bags? Do you have backpacks for them so that it's less likely? Or if you don't have a car, so you can't keep it in the car, and you're going into a home that has a concern like clutter, dust, hoarding, what do you do with your bag? And so hopefully people are bagging them and going, at least putting them in a trash bag before they enter the the home. So respiratory hand hygiene and home care. So we talked about hand hygiene, we've talked about bag protocol, respiratory hygiene and home care. This is another way we can train everyone. This we want to get this message out to everyone. How do you try to keep your germs your germs? Cover your cough and sneeze. Dispose of tissues promptly. How many times have you walked into a loved one, whether it's one of your patients or your child or your husband or wife, and they're sick and there's a pile of tissues next to them, and like, no, put them in a trash can. But that is what people do, right? Or how many people still have handkerchiefs? So maybe I'm dating myself, but I still have had lots of patients that had the handkerchief and they're like trying to shove it back into their grass. I'm like, no, we've got to dispose of that. We can't keep that around all day. But handkerchiefs are still a thing. The last I knew, maybe it's less likely now, but and then teaching people to mask when symptomatic, and that's what I talked about. If you have families that are coming to visit, teach them to put a mask on when they're coming to see their loved ones, and then stay home if you're sick. So that's a hard message. Our healthcare workers love to wear the badge of honor of, yeah, I'm a little bit sick, but I'll be fine. I'm going to go take care of Mrs. Smith because she needs me. And she only likes me, and I do the best job. So I don't want somebody else going into Mrs. Smith's house. I want it to be me. So we have really tried to work hard since COVID to get people to stay home when you're sick. Stay home. You do not, there's other people that can do your job. We can make this work. And I think right now is the hard season, right? Because people have allergies, your staff. The allergy season's coming. Is it RSV? Is it COVID? Is it flu? Or is it allergies? But you know, something to be out there talking to people about. So cough etiquette, why to cover your cough in your like that. Um, Personal protective equipment, we've talked about gloves and gowns, masks, respirator. How many of you have N95 masks that you're testing, doing the testing on your staff with, and you're using N95? Probably many of you are not taking tuberculosis active TB. They're mostly probably in acute care if that's the case. But do you provide N95 masks for airborne isolation, not for COVID, but for airborne? Okay, you do have it. Okay. Tested at orientation and can be re or yes. So remember, it would be annual. You want to make sure you're doing it annually. And then if the shape of someone's face changes, so they grow a beard, they lose a beard, they lose weight during pregnancy, after pregnancy, the change of your face, you do want to make sure you're doing fit testing. So be cognizant if you're using it at 95s that you're doing the proper fit testing per the requirements. And then eye protection, and then proper donning and doffing. So how are you donning and doffing? And I did include a YouTube video that maybe you'll like and maybe you'd want to provide to your staff. Environmental cleaning and disinfecting. This is a hard area for you because it's someone else's home. Or are you making sure you provide the right cleaning product for your staff? And are they able to clean the areas? So, that they need, and can they clean their equipment before and after, making sure like the stethoscope nurses like to hang them around their neck, and when they're leaving that home, are they making sure they clean down their stethoscope before they go to the next patient. So just being very cognizant, and also educating your families on basic cleaning needs, because not everyone has the same level of knowledge about cleaning, right? So you want to make sure they know what they need to do, and especially if somebody has a diarrheal illness. There are a lot of great resources on the CDC that are patient facing and family facing on cleaning techniques for diarrheal illness. So safe injection practices, one needle, one syringe, only one time. This is a great thought process. We need to make sure that's how we're doing things. Aseptic technique every time, immediate sharp disposal. I'm guessing most of the time your biggest concern might be, where are we putting the dirty needle and how is it being maintained? Where is the safest place? And making sure, especially when you're walking into a hoarder home, that there's not like five, six uh, buckets filled up that aren't in a safe container. And then how do you deal with that? So if one of your staff member walks in and there's needles all over the kitchen because the patient is a diabetic, how is that being managed? Something to consider. Has anyone had that come in contact with a lot of used needles, and then what to do with them? No, I'm glad. Managing medical waste, so most home care waste or household trash. So you've done your care and you are going to need to wrap it up. And what are your staff doing with that? So they did a dressing change, they put it in the bag, and the trash can is full in the house. Is there a place that they can put it outside of the house? Bag and tie contaminated materials. And then I did include this link to New York State Safe Sharps collection program, just in case that's an issue. And then launder soiled linens safely. And I don't know, do any of your staff actually throw in laundry? And how do they do that? Do they know to be cautious about the stuff touching their bodies? Are they cautious about touching that dirty linen if somebody's incontinent? You know, there's a lot of things they can come in contact with dirty linens. Yes. So they do with gloves and are trained to keep it away from your body, right? So you got to make sure that you're not picking up that towel and it's against your body. So great. You guys are doing a great job. Um, Transmission-based precautions, so MRSA, C. diff, scabies. Hopefully, hopefully scabies isn't a problem. It's like the worst nightmare in long-term care if there's scabies outbreak. Droplets. So we know droplet precautions. We've talked a lot about that. Airborne TB, measles. And then there are times where you're not going to just use droplet. You're going to use droplet in contact. Maybe somebody is really maybe you have somebody with a trach who's actively coughing and acutely ill, and they're really coughing up a lot of mucus. This might be a person you want to wear more gear, right? You may want to use more PPE for that person. And then just employee health, I did want to come back a little bit. We talked about before they become an employee. And now let's just make sure we're keeping our people healthy. Don't come to work when you're sick. Follow return to work guidelines and guidance. Stay current with vaccines and protect yourself and your patients. Making sure work restrictions are what you making sure that your staff know what the work restrictions are. If they have an open area, maybe they came in contact with poison ivy, people are starting to clean their yards, right? So right now is the time where people might have open dripping rash. If it's icky, sticky, and drippy, we don't want to touch it, right? So we want to make sure people know. If I have a really bad case of poison ivy and there's blisters coming, I can't go to work with that on my hands. So being cognizant of those things. Healthcare worker vaccination. I talked a little bit about this, COVID-19, influenza, RSV, hepatitis B. Are there any others that you can think of? You can put that in chat. So, surveillance and infection reporting, you all are pivotal in understanding what's happening in your communities. If you start to see a rise in your community, your patients of having respiratory symptoms, it's important to acknowledge that, identify it, and report appropriately. Because if normally you have one person who has respiratory, but suddenly you have 10, that's something you need to be cognizant of and do something with. So identifying those early trends, you might be the person who brings forward the next pandemic because you've acknowledged, you've seen it, you're starting to see a change in your community. So being very aware of what's happening and report your communicable diseases as appropriate to your Department of Health, the way you're supposed to, and escalate potential outbreaks. Again, being familiar with your county Department of Health is really important because if you notice that situation, I have I have 20 people right now that have respiratory symptoms. I'm going to call my county Department of Health. Are you seeing an uptick in respiratory issues? That's important. Education, competency, and verification. So we talked about orientation training. There's many things you all are covering in orientation. I would say my passion is infection prevention and control. I highly recommend you take some good time to dive into the reasons why. It's not just saying do this, but get into the reasons why. Annual education, skills verification, prove that people know what they're doing and how to do it, like the donning and doffing videos. Do you know how to put on in the right sequence? Do you know how to take it off in the right sequence? And ongoing coaching and remediation. So if you do have people that are going out and doing the audits, are they comfortable doing education on the spot? And quality improvement in infection control, use infection control data to guide improvements, conduct audits and reviews, implement corrective actions, measure outcomes over time. So pay attention to your trends. Hopefully you have a long standing data so you can look at it from seasons. I think infection prevention and control seasons are really important. And so is looking at years, right? So this year, this seems to be on the rise, but this has gone out down. So what can we look at like that? And we've been talking a lot about emergency preparedness and infectious diseases. So pandemic and outbreak planning, that was the last presentation that I did. Having staffing contingency and PPE available and clear communication plans. Who are you communicating and when are you communicating those to? So documentation, documentation, documentation. You all know this. You are healthcare workers. You can never document enough. If it wasn't documented, it wasn't
Right.
done.
Me- Mel, I hear you accelerating to the finish line, and we are up against time. So
Well,
this has been excellent.
this is
But I
the
wanted you to,
takeaways.
yeah,
Yep.
there you go.
The takeaway, infection prevention protects everyone. Consistency matters in every home. Early identification saves lives. Everyone plays a role.
Wow, 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 wow. Thank you so much, Mel. That was incredible, wonderful information, beautifully presented. I hope our audience enjoyed it, and I look forward to hearing from you. We will be sending out slides, the slide deck to all of the people who registered. And please, when you exit, you'll be getting a link to our evaluation. And I implore you to please complete the evaluation. That feedback really drives our planning and helps us really reflect on the work that we do and how we can best deliver to all of you. So thank you very much and great job, and thank you, Melanie, Ronda. Appreciate it all. People are hanging out. You see that? This was a good one. We've not lost really anyone. So I guess you all want to continue. You want us to do it again? Is that what I'm hearing? We look forward to seeing you at our next webinar. We'll be sending out promotions for our webinar that will be at the end of the month of May. And again, uh, I hope you'll all join us there. And I can't help but promote the fact that we have an annual conference coming up. But we did put that in the chat, so I won't take your time. Thank you, everyone, and thank you, Mel, again. And
Thank
Fidel, I
you.
see you on the screen. Great to see you. Thank you.
Thank you, everyone.
Okay.
Thank you, Melanie.
Thank you.
Thank you.
Bye.
Bye-bye.